This is Dr. Sagar, working as an anesthesiologist and intensivist in Vrindavan Area Hospital. Today I am going to teach you regarding the basic life support. First thing is definition of the basic life support. Basic life support is the care which has been given by the healthcare professionals as well as the public professionals in order to provide an adequate CPR or cardiopulmonary resuscitation in case of any patient who is suffering from a cardiac arrest or a respiratory arrest or any obstruction of the airway. One more thing is, it's nothing but a psychomotor skills which has been applied over the patient in order to provide a high level of CPR or a perfect CPR or cardiopulmonary resuscitation with the help of AED. It is nothing but automated external defibrillator, along with in order to prevent the obstruction of the airway. First thing is the respiratory arrest. Here the patient will not be breathing, but we feel the pulse in these patients. That is the one thing, it's called respiratory arrest. One more thing is cardiac arrest. Here the patient will not be breathing, there won't be any pulse, and also there won't be any response from the patient. It is called cardiac arrest. First thing I will tell you regarding the components of BLS. We should always ensure the safety of the patient. Next thing is, immediately we should see the response of the patient. Afterwards, we should call for the help or emergency medical system. Okay, and along with that, next immediately start the compressions. Next, immediately we should see the patient whether his ventilation is good or not, whether he is breathing or not. This is just the information which is going to give for the public or like a normal lay person. Okay, everybody should know this so that we can save so many lives. That is the main thing. Okay. See, if you find any person lying down on the ground, then immediately we should see the patient or the person. Like response. How is the response of the patient? We should see the response first. First thing is, you should speak to the patient and you should stimulate the patient like this. Hello, hello. And we should stimulate the patient like this. If there is no response, and immediately you should see the respiration. How? Whether you can feel the respiration, or you can whether any movements of the chest is there or not, or you can also listen this one. What is that? The hissing sound of this one. Breathing. Okay. One more thing is, immediately you should feel for the pulse, especially the carotid pulse. Immediately for 5 to 10 seconds. It should not exceed 10 seconds. That is the most important thing. If the pulse is there, if the patient is not breathing, then immediately what we have to do is, we have to give the respiration, mainly by giving mouth-to-mouth respiration. That is the main thing. That is almost like 6 to almost like 10 breaths per minute it has to be given. Okay? This is the main thing is, this is the scenario which has to be done when the patient is in respiratory arrest. Okay? Here the respiration has been completely stopped, but the pulse is, but pulse we can feel. That is the main thing. Okay? One more thing is the cardiac arrest. Okay? Immediately we should see for the carotid pulse. If the pulse is not there, what we have to do immediately is always we should call for help. That is the one thing. That is also depending upon how many persons who are actually helping the patient. One is one single rescuer or lone rescuer, and one more is double rescuer. Okay, this is the most important. If one rescuer is there, he should immediately call for help. After calling only, he should start compressions and he should start compressions. Okay, and if double people are there or 2 people are there, okay, immediately they should start the compressions. One person has to go and call for the help, and afterwards, once the help has come, so that they will be ready to give the AED or any defibrillators like that. Okay, first thing. In case of patients with the cardiac arrest, we should check the pulse first thing. If there is no pulse, what we have to do immediately is we should start the CPR. That is nothing but cardiopulmonary resuscitation. CPR means cardiopulmonary resuscitation. Okay, means 5 cycles of CPR which has to be given. Each cycle of CPR extends for only for 2 minutes. Okay, that is the one thing. How we have to give the cardiac compressions? First thing is the number of cardiac compressions to be given in a minute is 100 to 120 per minute. Okay. One more thing is how you have to give. First thing is always you should stand or you should sit just on the right side of the patient. Along with that, you should always keep the hands. Keep the hands in between the 2 nipples and the lower third of the sternum. This is very important. Okay, and both the arms has to be locked like this. Okay, and you have to give the compression like this, and there should not be any bend in this one arms. That is the main thing. Okay, and the compression quality has to be very good, and the depth of the compression has to be around 2 to 2.5 inches or 5 to 6 centimeters. 5 to 6 centimeters. And always you should give some time to recoil of the chest. That is very important because in order to pull the blood which is from the periphery, that is the most important thing. Okay, and always the one cycle of CPR, it means that is 30:2. That means for every 30 compressions you have to give 2 rescue breaths. That is very important.